there, my name is Amy and I'm going to be one of the nurses that are taking care of you and your baby today.
Okay.
I'm just here to perform a quick newborn assessment, and then after that we're going to have another nurse come in and she's going to demonstrate the baby bath.
Okay.
And teach you some important care tips including safe sleep, when to seek medical help at home. If at any point you have any questions, just let me know, okay?
Okay.
To start off, I just want to check in with you. How has breastfeeding been going?
Good. No issues. He's been latching well.
That's good. And how many wet diapers have you noticed in the past 24 hours?
About 6 or 7. My husband's been handling some of those, I think.
That's good. And then what about bowel movements?
He had his first poop last night. Yeah.
That's good. Now I'm going to start the newborn assessment.
Okay.
And I'm going to make sure to walk you through everything just so you know what to expect.
Okay.
I'm going to start off with a quick general assessment where I'm going to look at your baby's color, breathing patterns, activity level, and their alertness.
Okay.
So your baby appears to be pink. It seems like they're breathing well, and there doesn't seem to be any signs of distress,
Okay.
which is good. And now I'm going to take the vital signs. I'm going to start with the respirations, then I'm going to move on to the heart rate, and then the temperature.
Okay.
And we use this order just to ensure that results are accurate, since babies don't typically like to be assessed.
No.
And if he begins to cry, then we could affect those results.
Okay.
And here I'm just going to do respiration. Since I can't see, I'm just going to hold on
Okay.
for a minute. He is breathing at 46 breaths per minute.
Okay.
With a regular rhythm and no signs of distress, which is normal. The normal range would be anywhere from 30 to 80.
Okay.
So next, I'm going to warm this up, and I'm going to listen to his apical pulse.
Okay. Do you want me to move
Yes,
this for you?
please.
Okay.
Good. His apical pulse is 136
Okay.
with a regular rhythm, and there doesn't seem to be any murmurs or extra heart sounds,
Okay.
which is good. And then we're going to move on to temperature. And we're just going to put this under and up,
Okay.
making sure that we baby's temperature is 37.1, which is in the normal range.
Perfect.
Do you have any questions so far?
I don't think so.
Next, we're going to do a quick pain assessment using the neonatal infant pain scale. This is a tool that just helps us look at the baby's facial expressions, which appear to be relaxed right now. Then we look at if they're crying or anything. Your baby seems to be really comfortable. And then I'm going to look at those breathing patterns again, which also seem to be relaxed. The tone on your baby's arms and legs. Those are also good and relaxed. And then lastly, we're going to look at the arousal state of your baby. He seems to be wide and awake looking around, which is good. All these point towards a score of 0, which indicate that your baby is in no pain or very mild pain. Next, we're going to move on to the head to toe section. We're going to start off with the fontanelle. So I'm just going to palpate the anterior one and the posterior one. And they appear to be soft and flat, which is normal. There's no signs of any swelling or bulging. Next is the skin section. His skin appears to be pink. There's no signs of any rashes. And his muscle tone seems to be good. Seems like he can move all his limbs equally. Next, I'm going to listen to your baby's lung sounds. Warm this up a little bit. It's not too cold. And we're just going to listen to the front ones, okay? appear to be clear on both sides. No signs of any wheezing or crackling, which is good. And for the last part of the head to toe assessment is the abdomen. So I'm just going to take a little listen to your baby's bowel sounds first.
Okay.
All of the bowel sounds seem to be active in all 4 quadrants. And next, we're going to palpate just the abdomen a little bit, just to see if it's any tenderness or anything.
Okay.
There. The baby's abdomen seems to be soft, non-tender, and non-distended, which are all normal findings. Before the next nurse comes in to demonstrate your baby's bath, do you have any questions?
I was just wondering about when we go home and go, like when I put the baby down in their crib, is there anything they're allowed to have? Like what would you have, do you have any tips about like safe sleeping? Or you see all this stuff on the internet and I'm just not sure what to believe.
Of course, safe sleep is definitely a really important thing to ask.
Okay.
Some things that you should remember to ensure that your newborn is safe when in their crib is remembering that they should always be sleeping on their back, in their own crib or bassinet. While we encourage you to room share, we don't encourage you to share the bed with your baby. That's just to ensure that like a sudden infant death doesn't occur.
Okay.
Your baby's sleep surface should be like firm with just a fitted sheet.
Okay.
We don't want to have any pillows or any loose blankets or toys in the bed. Even though I know we would all love to.
Okay, and for when we go home, like, is there anything I should come back for or like follow up with appointments or?
This is your firstborn, so it's completely normal to have any fears when it comes to taking care of them. But if you start to notice that your baby is having a fever greater than 38 degrees, or that your baby is struggling to breathe, maybe there's some like blue coloring around their lips, maybe they're appearing like more sleepy than usual and it's like hard to wake them up.
Okay.
Or if you notice that they're having any changes in how they're feeding, or maybe they're not having as many wet diapers, then these all could indicate that something serious is going on. So it's important that you should either come back to the ER or come and see a doctor immediately.
Okay.
Do you have any more questions?
I don't think so.
Okay, that's good. And remember, we're all here to help you if you need any help.
Thank you very much. Okay, good morning. I'm here to demo baby's first bath for Mrs. Brown. She was 1 day postpartum with her baby boy. I'm gonna go ahead and get started. I've already introduced myself and I'll perform hand hygiene and put on some clean gloves. So baby's temperature was good before the bath, and the room temperature is warm, and we're good to get started. So we're gonna make sure we cover baby. I tested the water temperature with my wrist, and the water temperature is 38 degrees from the thermometer. So we'll start with no soap. I'll dip it in the cloth, start with the eyes, moving inwards to outwards and changing parts of my cloth. There, and I'll get the rest of the face. And behind the ears, around the ears. There, now during this part, there's going to be a lot of the vernix behind their ears and stuff. We just want to make sure we leave some of it because it's good for their skin. There, and then after that, I'll move down, put some soap in the water. And then I'll move down to the neck and get under their chin. All their little chin rolls. There, and we'll do their torso, under their arms, and then I'll take one arm out at a time, and do, oh, sorry, baby's not moving very well. Do their arms and in between all their fingers. And then I'll move to the other arm. Again, getting in between all the fingers and under the arms. Then we'll just cover baby's top part up and move down to their legs. Switching parts of the cloth throughout, get between all their toes. Down the legs, toes, there, and then I'm going to cover baby's front and lift up and get down his back. Wash that. Now I'm going to wash the peri area with a different cloth. Trying to keep baby as warm as possible throughout. Wash. At this point I can like lift their bum and get underneath, or go from the back and like kind of get underneath. And then after this I will change the water and change my gloves and get some new fresh water to do their head. And now I'll just put some soap, scrub their hair. There. And then I would have like a cup to rinse their hair and wash that out. And then baby is all finished. And we can lift them, supporting the back of the head and between the legs. Take him down and dry baby off, keeping them covered. We're making sure we're getting under all the little creases in their neck. Do you have any questions for me so far?
I do. This is my first baby.
Okay.
I'm not really sure on like when I'm bathing him.
Yeah.
About like his cord.
Okay, so when you're washing the umbilical cord, you can just be gentle using like a mild soap. You want to keep it nice and clean and dry. Wash it about 2 to 3 times per day. And make sure that, I'll show you right now when we're putting the diaper on, that once you have the diaper on and it's all secure, you can fold it down just a tad so that it doesn't catch the cord or cause any irritation.
Okay.
There we go. And now the baby's nice and clean and dry. We'll put the swaddle. Lift baby's arm. Make sure they're all nice and cozy. There, and then I will give baby a hat and encourage skin to skin if their temperature is dropping or anything like that. There you go.
Thank you.